think of hormones, we think of the ovarian or gonadal hormones, estrogen, progesterone, testosterone. And we know that in women, estrogens and progesterones, as well as some other hormones, go up and down depending on their menstrual cycle. When you look across the lifespan, the prevalence of headache before puberty is about 1-to-1 male to female. At puberty, you start to see the split where it becomes 3-to-1 female to male. And that persists all the way through to menopause. We know demographically, like cluster headaches tend to be more affecting males versus migraines tend to be more female. And many hormonal headaches fit into the migraine subclass. We know that migraine has a very specific set of criteria to be diagnosed with migraine. So there's a progression where you have this prodrome, or like this precursor where you don't feel well, some fatigue, there can be some sensitivity to light and sound and smell. Then the actual headache phase. Some patients prior to that headache phase have a phase called aura, where they have visual disturbances. And then at the conclusion of the headache for migraine, there's this postdrome where people, again, kind of feel just malaise in general. Hormones are known to change as we come into later life and aging. At menopause, we have a loss of estrogen hormones. We know that at that time, many people often lose the headache but keep the aura. What's really interesting is when you look at hormone replacement patients, they don't necessarily have any changes in their headaches. When you look at the transgender community, when you have a male to female transition, headaches can get worse with the estrogens on board. When you go female to male, they tend to get a little bit better with testosterone on board. Even at the baseline level, you can see that in these different situations, hormones are playing a key role, but what that role is up for debate.